Have you ever wondered how wildfires, those raging infernos we see on the news, might affect your health? Stick around to find out because by the end of this video, you'll learn 10 significant ways wildfires can impact your health. Believe me, the insights are both alarming and enlightening. You wouldn't want to miss it. The year 2020 set a record with more than 58,000 wildfires in the United States alone, scorching over 10 million acres of land. The devastation is not just environmental. The health repercussions of these fires are an urgent concern as the climate crisis exacerbates their occurrence and severity. Hey there! Welcome to our channel, your one-stop shop for health and wellness. Before we dive in, here's a quick trivia question for you. Did you know that exposure to wildfire smoke can increase your risk of what common cardiovascular event? Is it A, heart attack, B, stroke, or C, high blood pressure? Stick around for the answer. Now let's get into it. Wildfires. They're mesmerizing, destructive, and surprisingly, closer to your lungs than you might think. Smoke from wildfires can travel hundreds, even thousands of miles. So even if you live a considerable distance from a wildfire, it could still affect your health. In fact, scientists found that wildfire smoke traveled from the west coast of the US all the way to Europe during the massive fires in 2020. So whether you're sipping coffee in Oregon or tea in England, wildfire smoke could be part of the mix. In fact, the 2020 Oregon fires led to Portland having the worst air quality of any major city worldwide for several days. That's not a record anyone wants to hold, and it's a stark reminder of the reach and ramifications of wildfires. The first health impact of wildfires is respiratory issues. Smoke from wildfires contains tiny particles and gases that can make their way into your lungs when you breathe. This can trigger asthma attacks, allergies, and bronchitis. Wildfires produce a dangerous mix of smoke and pollutants, including carbon monoxide, nitrogen dioxide, and particulate matter. For example, a study in California found that hospital admissions for asthma increased by nearly 50% during severe wildfire seasons. Moreover, an investigation in Australia discovered an 80% rise in respiratory hospital admissions in the areas affected by the 2019 to 2020 wildfire season. This implies that the influence of wildfires on respiratory health is a global concern, not confined to one geographical area. Second, wildfires can severely impact your cardiovascular health. Inhaling smoke increases the risk of heart attacks and strokes, as the pollutants it carries can cause inflammation and clotting. Researchers from the University of California discovered a 42% increase in the risk of out-of-hospital cardiac arrests during the 2015 wildfire season in California. This certainly underlines the gravity of cardiovascular problems arising from wildfires. A study published in the Journal of the American Heart Association found that exposure to wildfire smoke can elevate blood pressure, potentially leading to chronic hypertension. The same study also pointed to an increased risk of diabetes following prolonged exposure to wildfire smoke. Number 3, ever heard the phrase, "Where there's smoke, there's eye irritation"? No. Well, we may have made that up, but it's the third point on our list. Smoke and ash particles can cause burning sensations and redness in the eyes. Imagine trying to navigate your daily life with a constant feeling of grit in your eyes. Not fun, right? The potential for a health scare doesn't seem so distant now, does it? Smoke can cause stinging eyes, runny nose, and even severe cases of dry eyes. It's not a pretty sight, pun intended. The pollutants in wildfire smoke can also cause a condition called smoke-induced ocular syndrome, where people suffer from burning, itchy eyes for weeks to months after smoke exposure. Fourth on our list is the negative impact on mental health. Wildfires, like many natural disasters, can induce anxiety, depression, and PTSD, especially if you've had to evacuate your home. According to a study, infants born to mothers who were pregnant during the 2003 Southern California wildfires had slightly lower birth weights compared to those not exposed to the smoke. Additionally, older adults with chronic heart or lung diseases who already have compromised immune systems are particularly susceptible to the adverse effects of wildfire smoke. Following the devastating 2018 Camp Fire in California, many survivors showed symptoms of PTSD, anxiety, and depression months and even years after the event. Furthermore, according to the Centers for Disease Control and Prevention, CDC, children exposed to wildfires may experience sleep disorders, changes in school performance, and increased feelings of sadness and worry. Our fifth point relates to vulnerable populations. Kids, seniors, and pregnant women are at a heightened risk due to wildfires. For example, pregnant women exposed to wildfire smoke might give birth prematurely. Another study published in Environmental Health Perspectives found that the 2015 wildfire smoke in Indonesia led to an estimated 100,000 premature deaths across Indonesia, Malaysia, and Singapore, mostly among individuals already vulnerable, such as the elderly and those with pre-existing conditions. Hey, we're halfway through, and you're doing great sticking around. If you're finding this video informative and insightful, don't forget to hit that like button, subscribe to our channel, and check out the description box for useful resources. Alright, back to the hot stuff. Next at number 6, wildfires can cause skin irritation. Direct exposure to smoke or even the residual ash can cause itchiness, rashes, and dry skin. Consider this, even pets can experience skin irritations and other health problems due to exposure to wildfire smoke and ash. So wildfire can ruin not just your day, but also your complexion. In fact, consistent exposure to smoke can lead to premature skin aging, with symptoms like wrinkles and fine lines appearing sooner than they usually would. And it's not just the immediate effects of wildfire smoke on your skin that's worrying. Dermatologists also warn of long-term skin damage that could result from repeated exposure. Over time, the particles in smoke can break down collagen and elastin, which keep your skin firm and youthful. Number 7 is how wildfires can affect your food and water supply. Contaminated air quality can lead to toxic rainfall, which can, in turn, contaminate crops and water supplies. After the 2018 Carr fire in California, officials had to issue a do not drink order to certain areas due to potential water contamination. In some cases, the heat from wildfires can also cause chemical changes in the soil, making it water repellent. This leads to increased runoff and soil erosion, which can further contaminate water bodies. Besides direct contamination, wildfires can have an indirect impact on food safety. For instance, increased atmospheric carbon dioxide from fires can reduce the nutritional quality of crops, affecting their protein, zinc, and iron content. This can have significant health implications, particularly in regions where nutrient deficiencies are already prevalent. At number 8, did you know that wildfires can disrupt healthcare services? Yes, that's right. Hospitals may need to evacuate or emergency services may be overwhelmed, leading to delays in treatment. Hospital evacuations and service disruptions during wildfires don't just affect patients, they also have profound impacts on healthcare workers. These heroes at the front line face the dual pressure of their personal losses and the heightened demand for their services during these crises. During the 2017 Tubbs fire in Northern California, multiple hospitals and healthcare facilities had to be evacuated, disrupting ongoing care and treatments. This not only poses a threat to those requiring immediate medical attention, but also to those needing regular treatments for conditions like dialysis, chemotherapy, or prenatal care. At number 9, you probably didn't see this coming. Wildfires can even increase your risk of infectious diseases. How? Mosquitoes and other disease carriers can double in the wet conditions created after a fire is extinguished. Additionally, wildfires can create a favorable environment for fungal infections. The heat and moisture following a wildfire can spur the growth of fungi like coccidioidomycosis, more commonly known as valley fever. These spores can become airborne and inhaled, leading to potentially severe lung infections. After the 2016 Fort McMurray wildfire in Alberta, Canada, a spike in rat and mosquito populations was observed, leading to increased disease risk. This increased population of disease vectors can lead to outbreaks of diseases like West Nile virus, Lyme disease, hantavirus, and more. Lastly, at number 10, wildfires can lead to prolonged physical inactivity. Poor air quality often means we have to stay indoors, reducing our physical activity and contributing to a sedentary lifestyle. To make matters worse, the psychological stress of being confined can lead to unhealthy coping mechanisms, like overeating and increased alcohol consumption, further exacerbating health risks. During the 2020 wildfire season in the West Coast, people were advised to stay indoors for weeks to avoid unhealthy air, which led to a decrease in physical activity. It's not just a lack of exercise. People, particularly kids, who are cooped up indoors may experience increased screen time, leading to digital eye strain, sleep disturbances, and a general decrease in well-being. Wildfires are indeed a burning issue, posing significant multifaceted health risks. As wildfires become more frequent and intense, understanding these risks and taking preventive measures becomes more critical than ever. Phew, that's quite a list, isn't it? Now, before we wrap things up, let's revisit our trivia question. The answer is all of the above. Exposure to wildfire smoke can increase the risk of heart attacks, A, strokes, B, and high blood pressure, C. This is due to the inhalation of pollutants, which can cause inflammation and clotting, leading to cardiovascular issues. All right, folks, that's our comprehensive roundup of the 10 ways wildfires can affect your health. We hope you found this video enlightening, if not a little scary. But hey, now that you know, you can take precautions to protect yourself and your loved ones. Before we go, don't forget to check out our other health-related videos on this channel. They're so hot, they're almost on fire. Hit that subscribe button, and let's keep the flame of knowledge burning together.